And going back to face masks for every Filipino, well, that's the president's new promise as he wants the wearing of face masks to be strictly enforced. To tell us more about this, we have Camille Samonte joining us live from Manila. Camille, the president talked about punishment for violators of not face mask wearing. What awaits them and what did he say exactly?
Sean, in the Interagency Task Force meeting Monday night, President Duterte vowed to distribute free masks, especially for those who can't afford them. He also warned the public to not trivialize wearing masks or else face punishment. Time and again, government officials have put the blame on the public for the country's continued spike in COVID-19 cases, attributing it to the inobservance of social distancing and the failure to wear face masks. But this time around, President Rodrigo Duterte wants the police to strictly enforce the wearing of face masks. Arrest and jail time, he said, will await violators.
The theory is that you are the carrier. That is why you should wear a mask so as not to pass on the infection to the other guy.
Duterte said he will try his best to provide face masks for those who cannot afford it.
I will try to buy as many as I can afford. Kung kaya ko, bigay namin yan sa inyo libre. But wear it.
The Interior Department is now working on a uniform policy on the wearing of face masks.
Gusto namin magkaroon po ng isang implementation lang po ng pare-pare sa bawat LGU kung ilang araw po dapat ikukulong yung mga nagbabiolate sa pagsusuot ng mask, face mask at hindi nagpi-physical distancing.
The palace said that they are still waiting for the formal ordinance before police authorities can enforce and arrest violators. The president, who has no medical background, has one more advice: reuse masks by soaking it in gasoline or diesel.
Gamitin mo siguro yan 2 beses, okay mo lang. O sprayhan mo lang ng alcohol pagkatapos. Huwag yung in-spray mo, isuot mo kaagad. Yung pagkatapos ng araw, hang it somewhere, sprayhan mo lang ng Lysol if you can afford it. Yung wala, ibabad mo ng gasolina o diesel.
The World Health Organization discourages people from disinfecting and reusing surgical masks. Medical experts also advise against the use of face masks with valves, as these do not block the transmission of the virus. The medical city, for one, has prohibited its use in its premises. But if it's any consolation, a London study showed that 91% of Filipinos always wear masks when leaving their homes, ranking second in the world. Sean, the UP Octa research warned that the number of COVID-19 cases could surge up to 85,000 by the end of July as the public becomes more mobile due to its restrictions. Sean?
Right, thank you, Camille Samonte. That was Camille reporting to us live from Manila today. And after allowing spouses and partners, family members might soon get a motorcycle back ride. The Joint Task Force COVID Shield says they are likely to soon allow pillion riding for family members as soon as community quarantine is lifted. Currently, only spouses or couples living together are allowed to back ride so long as a protective barrier has been set up. Many netizens have been blaming the said shield for motorcycle accidents, with groups already contesting its usage due to safety issues. Meanwhile, motorcycle ride-hailing firm Angkas has tapped the UP College of Public Health to study the viability of the resumption of motorcycle taxis under the new normal. The study aims to explore potential layers of protection to reduce the chance of COVID-19 infections among drivers and passengers. Government has recently said that Angkas no longer has a franchise to operate.
Given the necessary or the proper research and study, and then implementing and strictly enforcing the health measures based on that research, I think there's a possibility that we can make it viable as a form of public transportation during COVID-19.
And the UP experts recommend the use of shields to offer additional protection. They also said that there is minimized transmission in motorcycles due to ventilation.
it will always be better to have different layers of protection, different layers of control, so that we can definitely reduce the risk of transmission of the virus.